Doctors should not treat patients with COVID-19 with a combination of drugs touted by President Trump. This is according to new guidelines released today by the National Institutes of Health. The experts say no drug has been proven to be safe and effective for treating the virus, including hydroxychloroquine. As a result, they say there is just not enough evidence to make a recommendation about the vast majority of early treatments. The guidelines state the only time patients should be given hydroxychloroquine along with antibiotics is part of a clinical trial. The NIH says it will update the guidelines in real time as more becomes known.
Our state is about to transition from stay-at-home to safer-at-home, and many questions are out there. So let's bring our 9 health expert, Dr. Payal Kohli, in for a medical perspective on some of these policies and the changes therein. First, let's talk about testing, though. That was a big topic today with Governor Polis today. What about testing? What are we going to get out of testing as we continue to go forward with it, Payal?
So Tom, I like to think of testing as this analogy. So think of yourself camping in the woods and you're in new, unfamiliar surroundings. You're lost and there's nothing to guide you back. It's dark and it's late at night. Testing is the lantern and the compass that's going to guide you back. So it tells you where the next stepping stone is. And we spend all our time coming up with all these models that make all these assumptions to try to understand the behavior of the virus. Testing tells us what it's actually doing in the community. So it really helps us to make decisions based on what is actually happening with the virus rather than the models, which we know are full of assumptions. Now, let's say we relax social distancing without having testing in place, and I head out next week and get my hair done and get a tattoo. How is anyone going to know that I'm starting to get sick unless we start to test people? So the virus is not going to come up and tap us on the shoulder and tell us that it's resurfacing again. We really have to have a program of widespread testing in place in order to know that it's coming and in order to be prepared for it so that we're not caught with our pants down when it comes back. Because as we relax social distancing, it's important to understand the cases will go up. It's just a matter of making sure we stay ahead of the virus instead of it getting ahead of us, and testing helps us to do that.
Testing sounds like quite an undertaking. Listening to New York's Governor Cuomo today talking about contact tracing and trying to get that going as well. It sounds like these problems, as soon as you really start to think about them, the idea of testing or tracing people, these are massive undertakings.
Extremely massive, and that's why Governor Cuomo says we need an army of people. And what we saw has worked abroad has really been using things like technology and artificial intelligence, GPS tracking to help with some of that contact tracing. But those are all the pieces that we need to have in place. And until we have those ducks lined up, there's a real concern that we're opening up too soon and we're going to get that big spike that we worry about.
Here in Colorado, the idea of restricting the movement of people 65 and over, I imagine you think that's a sensible approach, but also maybe something that all of us should be paying attention to.
Tom, it is sensible, and I appreciate the governor trying to make a compromise, but 65 is arbitrary. We know the virus doesn't follow rules. We know young people get sick. We know that 38% of hospitalizations in the United States were people under 65, and 20% of deaths, according to the CDC's data from March, were people under 65. We also know that these young people spread the virus. So I think it's really important to keep that in mind, that it's important to try to figure out who the higher risk groups are, but in some ways we're all high risk and the virus doesn't follow age cutoffs. So I'm also concerned about this approach being somewhat high risk.
And the gatherings of 10 or more, is that still considered somewhat of a safe number?
Do you remember we talked about exponential spread way back when?
Yeah.
And if you have people getting in gatherings of 10 or more, and even one of them is sick, they're going to give it to those 3 people, and those 3 will take it to 3 more, and we're just going to let the horse out of the barn again. So again, very arbitrary. The more you gather, the more it's going to spread. It's a scientific fact.
All right, Dr. Kohli, we always appreciate our chance to chat with you. Thanks.